Welcome to today's workshop. My name is Jason Hamilton, and I'm the founder of Keep It Simple Financial Planning. And we're going to call this the Keep It Simple Financial Podcast. So welcome today to our first episode of the Keep It Simple Financial Podcast. Today, we're going to spend some time on a very important subject called Medicare. What I want you to take away today is the basics and the foundations of how Medicare works. So if you're somebody who's between the ages of 60 to 64 and a half or so, this is going to be very useful and very important for you to pay attention to because there are some gotchas when it comes to Medicare, and I want to make you aware of those today. So without further ado, let's jump right into our workshop today, 30 minutes on Medicare basics. Welcome everyone, thank you for coming. Once again, my name is Jason Hamilton with Keep It Simple Financial Planning. We specialize in retirement planning, and Medicare is one of those subjects that everybody pretty much has to deal with. Very few people get to avoid Medicare. And like I said, this will be about 45 minutes or so, hopefully 30 to 45 minutes, somewhere in that range, about some of the things that you need to know about healthcare when planning for your retirement. So get your pen and paper ready and let's dive right in. What is Medicare? In simple terms, Medicare is a national health insurance program for people age 65 and over, administered by the Centers for Medicare and Medicaid Services. And you enroll through the Social Security Administration when it's time. Everyone over the age of 65 is eligible for Medicare. This includes all U.S. citizens and legal residents who have lived in the U.S. continuously for at least 5 years. Some people under age 65 can get Medicare if they receive Social Security disability benefits. Our discussion today will pertain to the first group, which is people over 65. All right, so there's 4 parts of Medicare. Medicare is divided into 4 parts. So Part A covers part of the cost of hospitalizations, okay? Doesn't cover everything, so we're going to go into that today. Part B covers part of the cost of medical services, such as doctor visits, procedures, and diagnostic tests. The bills for Part A and Part B are paid by Medicare. Part C and D are where private insurance comes in. Part C is an alternative way to get to Medicare. You can sign up for a Medicare Advantage plan offered by a private insurer and get all of your services under Parts A and Part B, and usually prescription drug coverage as well. That usually goes through that plan. So instead of Medicare paying for your hospital and doctor bills, it pays the insurance company offering the Medicare Advantage plan a flat payment for each enrollee. Then the plan is responsible for managing and coordinating your care. Part D is prescription drug coverage. It is offered by private insurers who contract with each prescription or the contract with Medicare. Each prescription drug plan is slightly different, which is why you'll want to shop carefully for your drug plan. Even if you don't take any prescription drugs when you first go onto Medicare, you'll want to sign up for Part D because if you go without drug coverage for very long, you will face a penalty when you finally do enroll. So that's something to be aware of. All right, so this image shows 2 ways to have Medicare. If you go with original Medicare, you sign up for Parts A and B. Then you decide if you want prescription drug coverage under Part D. This shows drug coverage as optional, but it can be dangerous to go without drug coverage, so we are recommending that everyone plan to have some kind of prescription drug coverage starting from the outset of Medicare. In step 3, you decide if you want supplemental coverage. Again, Medicare shows this as optional, but we think it's pretty important because Medicare leaves too many gaps. The second way to get coverage for Medicare is through a Medicare Advantage plan offered by a private insurance company. There are many companies in this area offering Medicare Advantage plans. And from what my understanding is, they've gotten a lot better over the last couple of years and they're going to be getting better going forward. So if you go this route, it will be important to shop for plans and find one that meets your specific needs. And again, drug coverage is shown as optional, but we would recommend that you choose a Medicare Advantage plan that offers prescription drug coverage. So when you are going to sign up for Medicare, I do recommend that you work with a broker because there are a lot of different plans sometimes, even within the same state, that can be different costs. We're going to talk about that a little bit more today. But if you work with a broker, you do not pay any more. The commission that the broker receives is paid by the federal government. So you're not going to have any change in what it costs you, but getting the proper plan with the proper drug coverages that you need is going to be very crucial. And then also some of these Medicare Advantage plans especially, they can vary in price. So you want to make sure you're getting the right one for you. All right, so let's talk a little bit about Medicare enrollment. Here are the fundamentals of Medicare enrollments. This is the main principle. Unless you are covered by an employer group plan that covers 20 or more employees, you must enroll in Medicare when you turn 65. So what if you don't enroll in Medicare on time? The consequences are pretty dire. First, you'll be charged a late enrollment penalty, and the longer you go without enrolling, the higher the penalty will be, and it will continue for the rest of your life. The second consequence is that your healthcare expenses may not be covered by insurance. As I mentioned, Medicare is the primary payer in most circumstances. If you have other health insurance, it will not pay its share until Medicare pays its share. So if you don't have Medicare, you could end up getting stuck for the whole bill. And finally, your private insurance options may be limited. If you're in poor health or have a pre-existing condition, the private insurers that coordinate with Medicare have to take you if you sign up for Medicare during your enrollment period. But if you don't, and you go to apply for private insurance later, you may not be able to get insurance, or you may be charged a higher premium. All right, so how do you enroll in Medicare? If you are receiving Social Security when you turn 65, you will automatically be enrolled in Parts A and Part B. If you're working and covered by an employer group plan, you may not want Part B. In that case, you can decline it. Otherwise, you'll go ahead and accept Medicare Parts A and B, and your coverage will start on the first day of the month you turn 65. Parts C and D are not automatic. If you want a Medicare Advantage plan, you'll have to contact the insurance company offering it and sign up for Part C through them. Or if you want to stay on the original Medicare and have a standalone Part D prescription drug plan, you'll need to decide which insurance company's plan you want to go with, and you'll have to proactively enroll. You should do this at the same time you are enrolled in Parts A and Part B before your 65th birthday. Right, so what if you're not receiving Social Security when you turn 65? More and more people are continuing to work, or at least delay the start of Social Security in order to receive a higher benefit, which, by the way, will pay off for the majority of people. So keep that in mind. So in this case, you'll need to proactively enroll in Medicare during a Medicare enrollment period. There are three main Medicare enrollment periods. The enrollment period applies if you are not covered by a group plan that covers 20 or more employees when you turn 65. If you are covered by an employer group plan because you or your spouse is still working, you have a special enrollment period, which I'll explain in a moment. If you miss either one of these special enrollment periods, you can sign up for Medicare during the general enrollment period. Right. The initial enrollment period for people who aren't covered by a group plan at 65 starts 3 months before you turn 65 and lasts until 3 months after you turn 65. So there's a 7-month window there, 3 months before, 3 months after, plus the month you turn 65. So although it lasts a total of 7 months, you really should plan to enroll in Medicare during that 3-month period before you turn 65. Then your Medicare coverage will start on the first day of the month you turn 65. By the way, if your birthday happens to be on the first day of the month, everything is moved up 1 month. So just pretend your birthday is in the previous month. So for example, if your birthday is June 1st, your initial enrollment period would start February 1st. If you sign up during February, March, or April, your coverage would start May 1st. Okay, so hopefully that makes sense. All right, we've been talking about signing up for Medicare as a whole, but there are times when we need to break it up into parts. Most people will sign up for everything all at once, but there may be times when you want to sign up for some parts and not others. If you are still working when you turn 65, check with your benefits administrator to see if you should sign up for Part A. We mentioned earlier that if you're covered by an employer group plan when you turn 65, you will have a special enrollment period that comes up later. However, you may want to sign up for Part A when you first become eligible for it at 65. The reason is that it may offer better coverage for hospitalization than your employer group plan, and Part A is usually free to you. But check with your benefits administrator anyways just to confirm. If your employer group plan is a high deductible health plan paired with a health savings account, also known as a HSA, and if you want to keep contributing to the HSA, you should not sign up for Part A. The reason is that once you enroll in Medicare, your HSA contributions must stop. But let me be clear, if you have an HSA and your employer plan covers fewer than 20 employees, you will have to drop the HSA and sign up for Medicare during your initial enrollment period at 65. Right, so if you are not covered by an employer group plan when you turn 65, you'll want to sign up for Part B during your initial enrollment period, preferably during that 3-month period before your 65th birthday. So if you're not working, if you're self-employed, if you're employed by a company that has fewer than 20 employees, if you're on COBRA, even if you're receiving retiree health benefits, you'll want to sign up for Parts A and B during your initial enrollment period. If you signed up for Parts A and B during your initial enrollment period, and if you think you will ever in your life want prescription drug coverage, you should enroll in Part D at the same time. If you go more than 63 days without creditable prescription drug coverage, you will pay a late enrollment penalty when you finally do sign up for Part D. So it's better just to go ahead and get your drug coverage from the outset, even if you aren't currently taking any prescription drugs. As I mentioned before, you have two options. You can enroll in a standalone prescription drug plan if you have original Medicare, or you can get your drug coverage through a Medicare Advantage plan. That takes care of the initial enrollment period. Now we're going to talk about the special enrollment period. This is for people who were covered by an employer group plan that covers 20 or more employees when they turn 65. In this case, you will not be penalized for not enrolling in Medicare at 65, but you will be penalized if you don't sign up during your special enrollment period. The best time to sign up is before your current coverage ends. That way you'll have no gaps in coverage, but you'll actually have a grace period of several months to avoid late enrollment penalties. For Part B, that grace period starts the month your coverage ends and lasts for 8 months. For Part D, it's only 63 days. To summarize, you can avoid late enrollment penalties by signing up for Medicare during your initial or special enrollment period. But to avoid gaps in coverage, which is even more important, you should sign up before your current coverage ends. So what if nobody ever told you about the Medicare enrollment periods and you didn't sign up when you were supposed to? Well, you can still sign up, but now you have to do it during Medicare's general enrollment period, which runs from January 1st through March 31st of each year. This is the only time you can sign up for Medicare if you're outside of the initial or special enrollment period. Coverage starts the month after you enroll, so as you can see, this could leave you with some coverage gaps. So you really want to avoid having to sign up during the general enrollment period, but it may be the only option for some people. The important thing to know is that you can't just sign up for Medicare as soon as you realize you failed to do so. If you're outside the general enrollment period, you have to wait until the next one rolls around. So let's do a quick review of Medicare enrollment periods because this is important. The initial enrollment period is for everyone age 65 who is not covered by an employer group plan that covers 20 or more employees. The best time to sign up is 3 months before your 65th birthday, and Medicare coverage will start on the first of the month you turn 65. The special enrollment period is for everyone over 65 who is covered by a current worker or a spouse of a current worker under an employer group plan that covers 20 or more employees. The best time to enroll in Medicare is before that coverage ends. Then your Medicare coverage will start on the first of the month of enrollment. The general enrollment period is for people who did not attend this presentation and didn't know they needed to sign up before Medicare during their initial or special enrollment periods. They can sign up between January 1st and March 31st each year with the coverage starting the month after you enroll. How do you sign up for Parts A and Parts B? It's very easy. As I mentioned, if you're already receiving Social Security when you turn 65, you'll be automatically enrolled in Medicare. If not, you can go to ssa.gov, click on Medicare, and click on the big Apply for Medicare Benefits button. Or you can do it by phone calling Social Security at 800-772-1213. Part D isn't quite as straightforward because when you first have to decide how you want your prescription drug coverage, whether you want a standalone prescription drug plan or a Medicare Advantage plan. In either case, you'll be shopping for plans offered by private insurers. Once you've decided on the original Medicare versus Medicare Advantage and then chosen a specific plan, you can enroll in Part D through the insurance company or through Medicare. This is where you might want to get a broker involved to help you make this decision. All right, and this brings us to Part 2, Medicare and private insurance. Focusing on the out-of-pocket costs paid by Medicare beneficiaries, they fall into two main categories: premiums and out-of-pocket costs. Monthly premiums are paid to Medicare and to the private insurance companies offering the drug plans and Medigap Policies or the Medicare Advantage plan. Out-of-pocket costs include deductibles, the portion of the deductibles not paid by Medicare, and the services not covered by Medicare. First, let's look at monthly premiums. Part A is free if you or your spouse has paid into Medicare over 10 years. This is one reason most people sign up for Part A when they turn 65, even if they're covered by an employer group plan. It doesn't cost anything. Part B is different. It costs $164.90 per month in 2023. The Part B premium is adjusted for inflation, so it might be higher next year. Also, higher income beneficiaries will pay more. The Part B premium is paid to Medicare. Part D premiums vary depending on which plan you choose, The Part D premium is paid to the private insurance company whose drug plan you choose. This table shows the Part B and Part D premiums for the different income levels. If you're single and your income is under $97,000, or if you're married and your income is under $194,000, you'll pay the regular Part B premium of $164.90 per month. There will be no income-related adjustment. Your Part D premium will vary, but if you pick a plan that charges the average premium, you'll pay about $40 per month for a total of about $205 per month for Part B and Part D coverage. If your income falls into one of these other tiers, it's over $97,000 for a single filer or $194,000 for a joint filer, you will pay an income-related adjustment amount on top of the base premium. For example, if you're in the second tier, you pay an extra $65.90 for Part B and $12.20 for Part D on top of your regular premiums. This will bring your total up to $283 per month. Keep in mind that these are per person. So if you are a couple, you can double these amounts. Your tax return from 2 years ago is used to determine the income-related adjustments. For example, the adjustments for 2023 will be based on the income reported on your 2021 tax return. And keep in mind that the premiums shown here do not include premiums for Medicare Advantage or Medicare Supplement plans. This is only for Part B and Part D only. In addition to premiums, there will be some other out-of-pocket costs under Medicare. If you have to be hospitalized, the first $1,600 in hospital costs will come out of your own pocket before Medicare starts paying. Some private insurance plans will cover this, as we'll see in a minute. The Part B deductible is a reasonable $226 per year, and this is waived for some preventative services such as flu shots and certain screenings. The Part D deductible is $505 per year under the standard Medicare design, but Part D coverage is quite complicated, as we'll see here in a minute. After you've met your deductibles, there are some other costs. Medicare does not pay your entire medical bill. If your hospital stay exceeds 60 days, you'll be responsible for $400 per day up to the 90th day, and then $800 per day up to the 150th day. After that, you'll pay the full cost. Medicare pays the full cost of 20 days of skilled nursing care. After that, you'll pay $200 per day for days 21 through 100. If you need more than 100 days of skilled nursing, you'll pay the full cost. As for Part B, your responsibility is 20% of the Medicare approved cost. Doctors who accept assignment agree to be paid directly by Medicare and will not bill you any more than the Medicare approved amount. Doctors who don't accept assignment may charge more. If they don't charge more than 15% over the approved amount, Medicare will pay 80% of the Medicare approved amount, and you'll be responsible for the rest. So the 20% plus the 15% over. Under the standard drug plan, the beneficiary pays a $505 deductible. Then 25% of drug costs after that deductible has been paid. Then there is a small copayment once out-of-pocket spending has reached $7,400. So just so you know, the Inflation Reduction Act will be changing this over the next few years and bringing some of these costs down. So I want you to keep that in mind, but this is current as of 2023. But drug plans vary widely. Some will pay more, requiring you to pay less. It will be important to find a plan that covers the drugs that you take. So you really want to make sure you get this on an individual level. After looking at out-of-pocket costs that you have to pay, you might be wondering, what does Medicare cover? Well, it covers the first 60 days of hospitalization, minus the deductible, of course. It covers 80% of your doctor bills, and it covers some preventative services. The best reference for finding out what Medicare covers is the Medicare and You book. To get it, you can call 800-663-4227 or go to www.medicare.gov. The Medicare and You booklet spends over 20 pages talking about what Medicare covers and only one page talking about what it doesn't cover. I'm not talking about partial payments. I'm talking about no coverage whatsoever for the list of services that you see here. So now, some of these things you can avoid. Cosmetic surgery is optional, of course. If you never go outside of the United States, you don't have to worry about that. But some of these other things may be necessary. Dental work, eyeglasses, hearing aids, but these are things that you'll have to cover yourself, so you might want to be aware of that. What I found is, unless you can get some sort of group plan with dental care, a lot of times it can make more sense to do cash pay on dental care, but you definitely want to do some research around that. This is where private insurance comes into play. Private insurance can cover all or part of your deductibles, those hospital costs after 60 days, and the 20% of doctor bills that Medicare doesn't pay. And of course, all prescription drug coverage is offered through private insurers who contract with Medicare. Medicare alone doesn't cover them, Depending on the drug plan you choose, it may cover the deductible, and it should cover most of the cost of certain drugs during the initial benefit period and the catastrophic coverage period. But it won't cover all drugs. Each plan has its own list of drugs called a formulary, and it won't cover much, if anything, in the donut hole. Medicare supplement insurance, commonly called Medigap policies, are issued by private insurance companies and are designed to fill the gaps that Medicare doesn't cover. Although they are not affiliated with Medicare, they do have to follow certain federal and state laws designed to protect you. Medigap insurance policies are standardized. They're identified by the letters A through N. So if you buy a Plan F in California, it will offer the same benefits as Plan F in New York. However, the premiums can vary considerably from company to company and from area to area. For example, in one Florida county, the monthly premiums for Plan F range from $192 to $465 per month for the exact same policy. That's why it's so important for you to carefully evaluate Medigap insurance and not pay too much for it. Medicare Advantage plans, also called Part C. These are offered through private insurance companies that contract with Medicare. Medicare pays an amount to the plan for each member's care, and the plan is responsible for providing the care. You may have to use a network's doctors or hospitals. You'll want a plan that includes prescription drug coverage, and you may even be able to get extra benefits like vision care. But the benefits and cost sharing for Medicare Advantage plans are different than those for original Medicare. So again, you'll need to shop carefully and choose a plan that fits your needs. And this is just a reminder, once again, to shop carefully for private insurance. Medigap policies are standardized, but the premiums vary considerably. First, choose a plan that offers the coverage you need. Plan F is the most comprehensive plan. Then choose a reputable company offering up the policy at the lowest price. And before signing up, check with your provider's billing department to make sure they process the billing for the company you choose. Otherwise, you'll have to pay bills yourself and then file a claim to get it reimbursed by an insurance company. You really don't want to deal with that at all possible in retirement. Drug plan benefits vary considerably. If you don't take any prescription drugs at present, you can choose the cheapest plan available. You can always switch to a more comprehensive plan later. If you do take prescription drugs, you'll want to examine each plan's drug list to see what kind of coverage is provided for the medicines that you take. And the same with Medicare Advantage plans. Evaluate each plan's offerings and costs and make a clear choice about which private insurance to go with. As a wrap-up, we're going to talk briefly about overall healthcare costs. We do not want to get into the weeds here, but if you want to have a realistic understanding of the challenges of building a retirement healthcare budget, we have to go over some basics here. So what can cause your healthcare budget to change? Really, it's two things: inflation and the possibility of getting sick. As healthcare costs continue to rise, insurance premiums go up, and the non-covered services that you pay for yourself will get more expensive. If you get sick, you may need more expensive prescription drugs and have to spend so much that you find yourself in the donut hole, having to pay many thousands of dollars a year for your medications. And there's always the possibility that as you age, you'll require more non-covered services like major dental work, hearing aids, or long-term care. How can you plan for rising healthcare costs when you might be on fixed income when you retire? One way is to set aside enough funds to cover your future healthcare costs before you retire. Fidelity does a study every year to determine how much the average couple might need at the start of retirement to fund all of their future healthcare costs, not including long-term care. They say the average couple will need about $315,000. The Employee Benefit Research Institute did a similar study with slightly different variables and came up with $142,000 for men and $159,000 for women, and $296,000 for couples, so relatively close. But these are just averages. If you live longer than the average life expectancy, or if you have different healthcare needs, you might need more. And remember, these amounts do not include long-term care. How many of you know someone who's gotten old and needed long-term care? We're not necessarily talking about nursing home care. Long-term care can range from somebody coming to the home a few hours a week to help with meal preparation to skilled nursing care. If you guys have heard me talk about this before, I think robots are going to come and fix this problem in the next 10, 15, or 20 years, but it's not there yet, so we do need the plan still. The important thing to know is that Medicare and Medigap do not cover long-term care. The most comprehensive Medigap policy pays for 100 days of skilled nursing care only. But if you're not sick enough for skilled nursing care, they're not going to pay for it. The average period of skilled nursing care is just 28 days. And when it comes to custodial care for help with activities of daily living, there's no coverage at all. How much does long-term care cost? Well, it varies with the type of care, of course. The Genworth Annual Cost of Care Survey shows us that the median cost around the United States. Homemaker services cost about $163 per day, and home health aid services cost about $169 per day. Adult daycare costs about $78 per day on average. However, it can range from $30 to $160 per day. Residents in an assisted living facility can range from $3,000 to $7,000 per month, depending on location and amenities. The median monthly rate is $4,500 per month. The most expensive type of care, of course, is in a nursing home where residents can get skilled nursing care. A private room ranges from $200 per day to $1,200 per day. The median daily rate is $297. 1 year at this rate and you're spending over $100,000. And this is very common around the country. None of us want to think about getting old or needing long-term care, but there are some very compelling reasons why we need to. One is to spare your kids or family members from the burden of taking care of you. They might not mind doing your shopping or paying your bills, but if you were to need constant supervision or help with bathing or dressing, that's beyond the call of duty for even the most devoted son or daughter. Another reason to plan for long-term care is to avoid having to spend down assets in order to qualify for Medicaid. Medicaid is a state-run welfare program that will pay for your care if you don't have any money. But that's the point. You have to spend down your assets to less than $2,000 in order to qualify, essentially leaving yourself destitute. People on Medicaid don't have a lot of choices about the kind of care they receive. And this is another reason to plan for your own long-term care, to be able to direct your own health care and obtain the kind of quality care that you want. When you're paying for care out of pocket, out of funds that you've set aside for this purpose, or when you have insurance that's paying for it, you can decide how you will be cared for, whether it's in your own home or in an assisted living facility of your choosing. 3 reminders that relate back to the 3 key points that I talked about at the beginning of this presentation. Reminder number 1 is to enroll in Medicare on time. Know which enrollment period applies to you, whether you need to sign up at 65 or you can wait until your employer group coverage ends. And enroll when you need to in order to avoid penalties and coverage gaps. Reminder number 2 is to shop carefully for private insurance to go with Medicare. Evaluate all your options and choose the drug plan, Medigap Policy or Medicare Advantage plan that offers the coverage you need at a price you can afford. Don't be one of those people who pay too much for private insurance because they didn't know any better. And finally, plan now for higher healthcare costs in retirement. We know healthcare expenses will be higher than they are today, so when you're planning your retirement and figuring out how much savings you'll need to make your money last, be sure to factor in an extra amount for healthcare. You'll be very glad that you did. So that's what I have for you today. If you have any further questions, you can feel free to reach out directly. If you'd like to discuss further about planning for healthcare, planning for retirement, or just doing an overall retirement evaluation, we offer a complimentary consultation here at keepitsimplefinancial.com/talk, or you can call in to 877-673-8473 or 877-6-RETIRE. Same number there. And again, I want to remind you that planning for healthcare is a very important aspect. Planning for long-term care is a very important aspect. Long-term care is one of the things, after doing hundreds of retirement plans, that most people really don't want to think about. So I think a lot of people these days are opting to self-fund long-term care, and that may be the best option for a good majority of people. But keep in mind that long-term care insurance is still available there if you want to put the cost on the insurance company. It's really hard to, look at those decisions today because the long-term care insurance policies are not nearly as good as they were about 10 or 15 years ago. But the problem with the ones that were around 10 or 15 years ago is we're seeing people getting their insurance rates jacked up, 50 to 75% over the course of maybe 3 to 5 years. So these things are changing very quickly. So self-funding could be a good idea. Another note on self-funding. If you have most of your retirement money in pre-tax retirement accounts and you have a large expense for long-term care, and you have to take a big chunk of money out of your pre-tax retirement account to cover your long-term care, this could be, 1, a big tax bill, but 2, if one of the spouses were to pass away, this could leave the second spouse in a financial bind because their income for their Medicare and their IRMAA charges is based on 2 years prior. So I like the idea. Sometimes Roth conversions don't always make sense from a financial standpoint, but they can make sense from a planning standpoint in case you want to plan to have a long-term care bucket and have that in a Roth account. Because if that money's in a Roth account, obviously it's tax-free when you take it out. So these are all planning things you might want to think about. But if you have further questions, we're happy to help you out with that.